Hi, I'm Dr. Nadim Akhtar Khan, practicing as a consultant diabetologist and physician in BN Clinic 19, Kolkata.
Is brown sugar or jaggery better than white sugar for diabetics?
Frankly speaking, is a myth. Both type of sugar causes increase in the blood sugar level because of the rapid absorption. This brown sugar has a very high nutrient value. At the same time, it has a good content of mineral, so it is better. But consumption of both in a high amount will lead to the hyperglycemia, that is high blood sugar.
Is brown rice better than white rice for diabetics?
If you ask me that brown rice is better than the white rice, I will say that the brown rice has got very slow absorption, so its chances of hyperglycemia is less, that is high blood glucose is less. But overall, the management is that you should take in a moderate amount whatsoever you type of rice you are consuming.
Does walking after meals really help control blood sugar?
Now the another thing is that walking is very important as per American Diabetic Association guideline. We should walk at least 35 to 45 minutes, 3 times or 4 times in a week. But what I recommend that every person should have this habit of walking 15 minutes at least, because with walking, there is an increased insulin release and that lessen the hyperglycemia or high blood sugar.
Can diabetics have sweets occasionally, or should they avoid them completely?
A diabetic patient can take sweets. It's not nothing like that they cannot take sweet. They should take, but in a very moderate amount, because we are concerned with the calorie intake rather than how much the amount you are taking. High amount means high intake of the calorie. So you can intermittently you can take sweet, but it should be very less sweety. That is important.
Are artificial sweeteners really safe for long-term use?
Many people asking this question, but still there is some debate regarding this. Artificial sweeteners, actually it should be avoided. Better not to take it, because in the long term the studies is not very much comprehensive that it is safe. So better to you not to use it. Diabetic patient always have a very less immunity, and as their blood glucose level is always high, less immunity, less healing is one of the cause for that.
What's the difference between type 1, type 2, and gestational diabetes?
Yeah, this is a very good question. Type 1 is the patient who have the autoimmune destruction of their gland. It comes in the very early stage and the patient is insulin dependent in this case. The patient can go to any problem as early as possible, like the diabetic ketoacidosis is very common in this case. The type 2 diabetes come in the later stage of the life, and this is managed with the oral, and if not controlled then we have to give the insulin. Gestational diabetes means the diabetes during the pregnancy, and it all depends that early gestational or late gestational, but it also be dealt with insulin.
Does diabetes increase the risk of heart disease?
Diabetes is always it is such a type of metabolic disease that causes a micro and macrovascular complication. In the microvascular complication means that it can have effect on the heart and cause a heart attack, heart failure. It also can cause brain stroke. It can also cause peripheral artery problem leading to the peripheral vascular disease.
If my sugar levels are normal with medicine, does that mean my diabetes is gone?
It is also a myth that by taking this tablet my sugar has gone, but should not have the practice that we should stop the medicine. Rather we should lower the dose, and but control of diet is always important. Lifestyle modification is very important.